So our relationship between our federation here in Morecambe Bay and our local PCNs is really to act at scale across the locality. We have 12 PCNs and we have two GP federations. Our two GP federations are really there to act as an umbrella level where we can actually support the PCNs directly in their operational activities. I guess the work that we've done so far that really supports the PCNs that are still forming at the moment, they're not fully established, is to do things at scale that are common to all of them. So we're looking at workforce solutions. We've got a big workforce crisis within the NHS across everywhere and across every single GP practice. We look at improving quality for patients by redesigning pathways, and those are linking the system-wide pathways with the acute trust down to general practice and making sure that they're standardised across a locality. It's then up to the individual PCNs to start operationalising that according to their local need. The main things that federations can do to support an emergent PCN is really to learn on our experiences of working with GPs and GP practice staff, bringing together practices to start to work together. Individually, practices have been working in isolation in a lot of cases, and the emergent PCNs are really about bringing those practices together to talk about what their common issues are, what they could do together that would benefit the patients and the practice rather than working as individual businesses. In our patch in Lancashire and South Cumbria, we actually have some what's called enhanced training practices, and this is where a group of practices will start to take student nurses, allied health professionals, medical students and new physician associates, which is a new role that we're trying to implement in general practice. The training hub comes together so that basically we can coordinate the number of placements in practice, give students the exposure to working in general practice, so that actually for the first time they start to get to understand what general practice is like as a profession, and then they can then go into it as a later career. Previously, student nurses didn't ever have exposure to general practice. All their placements were in acute hospitals. Now we've started giving them exposure in general practice. They've started to be qualified and then employed straight away in general practice. We've actually had nurses say, I didn't know what general practice was about, but now that I've had a placement here, I know that this is the career for me. And they've gone straight into general practice from being newly qualified. One of the examples of where the Federation has worked and creating that ability to do things at scale once rather than doing it many times in isolation by individual practices is where we have done some workforce initiatives. We have looked at what our training needs analysis are across the whole locality in all the GP practices, and we've worked with our local universities to deliver bespoke courses that actually fit for general practice. That's something that couldn't be done in isolation, but actually can be done at scale across a whole locality where you've actually got the numbers enough to provide a course, for example, that actually mean that the staff are trained up to a certain standard and everybody's undertaking the same training, and so we know that everybody's achieving that same standard of training and care. I see the future for federations really going on from where we are now, which is working across a locality, across 12 PCNs in Morecambe Bay, to start to work together across the whole of Lancashire and South Cumbria. We've already started to see examples of this where we're starting to bring the training hubs together and starting to work even more at scale so that we can share best practice, make sure that we're all delivering the same standard of care, and really making sure that we're all linked in so that we're joining the dots and we don't have people doing things individually on silos or all on their own. I think it's a really exciting time for the future. We've seen lots of changes over the last 3 years and we're all trying to find our feet in the new system. I think this is a real opportunity for us to actually work together, do things once, do things better, actually think about it and do it properly rather than individual organisations doing their own thing. It actually means that we'll have a proper integrated system that will benefit the patient at the end of the day by improving the outcomes and the care that we deliver.